There's a lot of time and money invested into the filing of regulatory submissions for e-cigarettes and other novel nicotine delivery devices. It is important not to lose sight of the reasons why these products exist and the responsibilities that sit with manufacturers to ensure that their product is safe and of a high quality. Ultimately, such products are important to help realize a reduction in the morbidity and mortality caused by smoking combustible cigarettes, a concept known as tobacco harm reduction. The first step in putting such products on the market is to ensure that the manufacturing and supply chain are controlled so that every product that is manufactured performs in exactly the same way. This forms an important part of any regulatory dossier, whether it be for submission to the FDA in the US or the MHRA in the UK. Once the product can be proven to be manufactured under controlled conditions, the regulator will look at the entirety of the application to determine if launching the product on the market is safe and will not result in a negative impact on public health. Tobacco harm reduction was first described as an equation back in 2013 by Clive Bates. This conceptual equation shows that in order to achieve a population benefit, a product has to be proven to be reduced risk compared to a cigarette. But equally importantly, the product needs to be acceptable to current adult smokers. If current adult smokers do not switch to the novel product, the product's ability to positively affect population-level harm reduction cannot be realized. We have taken this equation and modified it to take into consideration specific concerns that regulators have, and we've created what we term a modified tobacco harm reduction equation. In the modified tobacco harm reduction equation, we have expanded out the consumer acceptance and inserted new conceptual terms to highlight additional data points that would be important in any regulatory submission to provide further confidence to the regulator. In this form of the equation, consumer acceptance is replaced with the appeal and use of the product amongst intended audiences, that's current adult smokers, minus the appeal and use of the product amongst unintended audiences like never smokers, ex-smokers, youth, etc. FDA have termed these scenarios as off-ramping from combustible cigarettes and on-ramping onto nicotine. What this modified equation shows is that for a given product that has a profile that is reduced risk compared to a combustible cigarette, only if the rate of off-ramping far exceeds the rate of on-ramping can tobacco harm reduction be realized. If it's the other way around, and the rate of on-ramping exceeds the rate of off-ramping, then the creation of new nicotine users negatively impacts population-level tobacco harm reduction. Of course, the ideal scenario is that there are marketing controls in place to ensure that there is no on-ramping with your product at all. It is important that through your application, regulators are confident that your product will positively contribute to tobacco harm reduction, and addressing these aspects in your application will strengthen your opportunities for regulatory success. In essence, a regulatory submission is an opportunity to tell the regulator your story about your product and why it will help accelerate a smoke-free future.